other specialist services, and are very, very concerned about the proposals at Charing Cross, but are also concerned, we're concerned as a borough, about the implications not only with Charing Cross A&E going, but also Ealing across the border.
Yeah.
How will the remaining A&E services be able to cope? We haven't yet been assured that there are adequate, that the remaining hospitals will be able to cope in the context of NHS cuts, in the context of rising elderly, rising rates of elderly needs and people who are frail and have complex health difficulties. The distances to the remaining A&E services has already been made. We estimated it was a 10-minute walk from our tube to here, and we didn't even get to St Mary's when we came here tonight. If you're ill and sick, has been mentioned, that isn't acceptable in the modern day and age. And we know the cost of taxis is well beyond the means of many people on low incomes and at very high rents in London. My concern about, you talked about the tri-borough arrangement and you've consulted with the 3 boroughs. I don't think that included Hounslow, despite the fact that a significant proportion of our population are within your catchment area. And therefore that also raises concerns that our borough, representing our people, will be left out of whatever gets sorted out for the local authority representation. I'm also concerned, I had the hope that AHSC stood for Adult Health and Social Care Representation. I realise it doesn't. And I have to say, in all the documentation, hospitals seem to be working at a distance, at a disjoint, from what is influencing much of hospital demand, which is the changing nature and the pressures on adult health and social care, on public health, and so on. And until we can get some sense of that, and with 2 local authority representatives and 1 CCG rep on the governing body, let alone the core board, that does seem to be not full representation. And finally, I'd like to know what will be the real relationship between all those governor representatives and their constituent parts. Or will they just be a talking shop, listening to presentations, asking questions, having a cup of tea, and then going home? I really am concerned about that, because a lot of the pressures on hospitals are coming from the withdrawal of funds, particularly in local authority, mental health care, and so on. I think we've had, in the last 3 years, 35% cut in government grant to London authorities on average, another 16% cut in government grant next year. Hospitals cannot work in isolation to these pressures, and I saw no mention of them in your documentation. Thank you.
Thank you very much.
Well done.
I think point well made, and I think had similar discussions when we met with the Tri-Borough Oversight Scrutiny Committee. I think I would like to correct one thing. I'm pretty sure that I talked about the consultation and the fact that we had 3 meetings, and we'd also involved discussions with other stakeholders. So I wasn't trying to say there that the discussion that we had in the Tri-Borough OSC in itself was the consultation. This is the consultation process, and as part of that we've had discussions and listened to what our stakeholders internally and externally have got to say and tried to respond to that. So I wasn't trying to say that that one meeting was the consultation. So just to be clear about that. I agree. The pressures from the withdrawal of funds to local government are very real. And we have also tried to be clear, and again, when we had the discussion about our clinical strategy at that meeting, we've talked about how we want to work in a much more integrated way. And integration doesn't just mean ourselves and primary care, it must mean ourselves and adult social care too. And we haven't been very good at that in the past, and it's one of the things that we need to improve on. And if that's not evident in the discussion and in the consultation, then that's an oversight on our part. But in terms of strategy that we're developing going forward, we very much see that integration is something that we need to be aware of and be involved in, and we want to, as far as possible, participate in that so that the care that's provided to patients is seamless. So I agree with that, and that's an oversight, and it's something that we will address.
Well, thank you very much indeed. I had a hunch that there was one other hand, because I think from the